Hello, good evening, everyone. I once again welcome you to my lecture series. We are continuing the psychology lecture series. My name is Kato Alex Male. Yeah, and we are presenting about self-care and stress management. So let's get started right away. The following are our lecture objectives for today. One, to define key terms used in self-care and stress management, understanding the concept of self-care and stress management, exploring different self-care practices, developing personalized self-care plans, and identifying common sources of stress in daily life, as well as learning effective strategies to learn to manage stress. Okay, to start with the terms, self-care refers to the practice of taking deliberate actions to preserve and improve one's health and well-being. In other words, you, the individual, these are some of the things you do to improve your own health, to maintain your health first and then to improve it. You get it? Eh? In other words, you're trying to prevent any harms that might come upon your body, that might come upon your health. Then stress management encompasses the range of techniques and strategies aimed at reducing or coping with the stress. Yeah, you're trying to reduce or manage stress. That is now those are the techniques. Then stress as a term, it is a term used to describe the body's physical and emotional response to challenging or threatening situations. We are going to see the effects of stress and how we can manage it. The other term is burnout. It is a state of emotional, physical, and mental exhaustion caused by prolonged distress or overwork. When an individual works beyond the normal, they tend to burn out. They tend to get tired, but this now goes beyond being tired. Yeah. And then resilience, it is the ability to adapt and bounce back from adversity or stressful situations. You're trying to resist, Yeah, you're trying to resist. In other words, a stressful situation comes over, but you try to resist it. You even get used to it being around, Yeah. And then mindfulness, it is the practice of being fully present and aware of one's thoughts, feelings, sensations, and surroundings without judgment. In other words, you're trying to have self-control over what you think, over your feelings, over what you sense. That's mindfulness. The concept of self-care. Self-care is attributed physical, mental, social, and emotional aspects of an individual's life. Yeah, it is attributed to physical. In other words, these aspects of the individual's life, that is the physical aspects, mental aspects, social, and then emotional aspects. Physically, you find out that self-care may include engaging in regular physical exercise, eating a balanced diet, getting enough sleep, and attending regular medical checkups. Then mentally, it may include engaging in activities that stimulate the mind. Yeah, this may include reading for pleasure. Yeah, like you try to read around novels, stories, you get it, huh? Pursuing hobbies. Like some people enjoy watching movies. Some people play games, video games, others play physical games. In other words, you're trying to engage in your hobbies as one of the aspects of self-care. Also learning new skills as a major aspect. Then socially, you try to build strong social connections with friends, family members, and colleagues. This is vital for maintaining emotional resilience and a sense of belonging. Uh, Remember, mostly, especially individuals, once they become victims of a certain condition, they tend to develop antisocial behaviors. They tend not to socialize with colleagues, neither families nor friends. Uh, and one of the aspects of self-care, one of the aspects under this concept is building stronger social connections. Yeah. Uh, then some of the common self-care practices, having regular physical exercise, yeah. Walking around, jogging, aerobics. In other words, An individual who cares about themselves, each day at least they might spend 30 minutes to 1 hour sweating. You understand? Engaging in the physical exercise. You understand? Even if it's walking, just walking around or running around the streets, there someone is having physical exercises. You understand? This is one of the most causatives of non-communicable conditions among cases, in a way that without physical exercise, you find out that individuals develop conditions like hypertension and other cardiovascular related conditions. Individuals develop obesity. You get it, eh? Yeah. Healthy eating as one of the strategy. Eat foods which are rich in fruits, vegetables, whole grains, and then lean proteins. Lean proteins are those meats. Those meats without fats, with little or no fat content. Those are the lean proteins. You take meat with a very, very low fat content. And also meditation. This is a very good strategy as a self-care practice because medication tends to make the brain concentrated on something. The other case is having a quality sleep. Yeah, this includes uh, having a quality sleep, a minimum of 6 hours. Yeah, sleep minimum of 6 hours, whereby you can have enough time for the body to refresh. That's the importance of sleep. Stress comes over when you lack sleep. Then building a healthy social connections. Now that is, you try to join colleagues or individuals who will help you in developing your psychology or your mental aspects. The other thing is engaging in hobbies and leisure activities. We have seen this, and also counseling or therapy. As it's a very good as a self-care to engage in counseling. Yeah, it's very, very good and very important. Reach out to your counselor, reach out to anyone, therapists. There are very many psychotherapists. Reach out to encourage your patients to reach out to them to seek help. These ones try to give good counseling that is the food for the mind. Then the concept of stress management. This is the process of controlling and reducing stress levels in order to improve overall well-being and productivity. Like we said at the times, you're trying to prevent stress and also maintain stress-free conditions. Stress management involves identifying sources of stress, developing coping mechanisms, how you try, how this is now includes how you can live around with the stress or how you can try to avoid it, and implementing strategies to minimize the negative effects of stress on mental and physical health. Effective stress management techniques can help individuals build resilience. They can become resistant to any psycho abnormalities. For example, depression. You get it? Yeah. So this enhances their ability to handle challenges and maintain a healthy work-life balance. So this was talking about the concept of stress management. Then common sources of stress that are known. We have work-related stress. This comes from job pressure, long hours of work, heavy workload, and conflicts with co-workers or supervisors. This all can contribute to stress in the workplace. Yeah, I guess there it is just known and easily understandable. Then financial stress. This concerns about money, such as debt, inability to meet financial obligations, or even worries about saving for the future. Whenever you get worried about saving for the future, such cases can bring about stress. Having very many debts are increasing day in, day out. You get it. You have your goals that you want to achieve. Because of the financial stress, you cannot make them count through. Then we have relationship issues. Here you find out that difficulty in personal relationships, whether with a partner, family member, or friend. Conflicts. So for this case, we are saying that personal relationships can come from your partner and can come from your family members or friends. Yeah. And these ones may include conflicts. These may include communication problems and feelings of isolation. You feel like they're no longer caring about you. You feel like they have neglected you as your friend, as your family. You get it, eh? Yeah. And then another source of stress is health concerns. Uh, for example, chronic illnesses. Yeah. So chronic illnesses, injuries, disabilities can all cause ongoing stress. This is because of the physical or emotional challenges they present. Chronic illnesses, first of all, present financial challenges. You get it? Yeah, and then like we saw stigmatization and discrimination amongst the communities. These all coming from chronic illnesses, injuries, or disabilities, and all can cause stress. Then major life changes, for example, moving to a new area, changing jobs, getting married or divorced, having a child, or experiencing death of a loved one. Yeah, these are all major life changes and they all can cause stress. Then social pressures, uh, feeling pressure to conform to societal expectations regarding to appearance, success, relationships, or lifestyle choices. Among the communities that we live in, the societies have expectations from us. The society is expecting you to do something. The society is expecting you to be at a certain level of success, at a certain level of appearance, but for you, you feel like you're not yet ready to be in such a category. And thereafter, you start developing stress. Then traumatic events, you find out that exposure to violence, that is domestic violence or any other violence, domestic, workplace, public violence, you get it. Natural disasters, accidents, or other traumatic events, these are all sources of stress. Then common stress management strategies. Now we are looking at how you can manage stress. Identify the stressor, that is the first concept. You cannot manage stress without knowing what causes it. Then health lifestyle choices. This includes, for example, smoking cigarettes. These are unhealthy. You understand? Yeah, lifestyle choices. So make choices which are healthy. For example, avoid cigarette smoking, reduce on alcohol intake or avoid it. Have regular physical exercises. You understand? These are all healthy lifestyle choices. Then mindfulness and relaxation, we say this is a food for the soul. Meditation, relaxation, mindfulness, all these ones involve an individual concentrating in one area or place, and then they start thinking of how they can overcome the problems that they are actually going through. Then time management, the way you divide your time, the way you spice up your day, on the activities that you assign yourself, yeah, it is also very crucial as a way of managing stress. Then social support, like we said, this comes from family members, this comes from friends. You understand? Yeah, social support is very crucial in managing stress. Engaging in hobbies, we talked about this. Some people enjoy singing. You can try to manage or prevent stress by giving yourself time to sing, giving yourself time to play some games, depending on the nature of games that you enjoy. That is now engaging in hobbies. Then the role of self-care strategies in stress management. One, physical health. We are looking at now strategies of self-care in how they can help us to manage stress. Yeah. Physical health may include engaging in self-care activities, for example, regular physical exercise, proper nutrition, sufficient sleep. These all can reduce physical symptoms of stress. For example, fatigue, tension, you understand? Yeah. And then emotional well-being practices like mindfulness, meditation, journaling, or seeking therapy can enhance emotional resilience and provide coping mechanisms for dealing with the stressors. Yeah, like I've told you, these are foods for the soul, mindfulness, meditation, you understand? Reach out to a therapist for counseling and guidance. These are all strategies for emotional and emotional well-being. Then relaxation techniques, incorporating relaxation techniques, for example, deep breathing, uh, progressive muscle relaxation, or aromatherapy can all help to alleviate stress and promote a sense of calm. Yeah, you try to find out those strategies that you can use to relax. Don't always be on pressure or under any tension. Uh, the other one is social support as another strategy under self-care. Building a strong social network through friendships, family, relationships, or support groups can provide emotional validation and practical assistance during stressful times. Remember, these are the individuals that you're going to reach out to for any stressor that comes on your way. Hobbies and interests as a strategy. We talked about this once again. I don't know. It's already like 30 times or fourth. Yeah. But it's still like I said, you try to do those activities that you feel like contented with. Yeah. Then avoid unhealthy coping mechanisms as a strategy. One, for example, substance abuse or avoidance behaviors. Such unhealthy mechanisms. Do not use substances because someone has been diagnosed with chronic illness. You understand? It doesn't mean that it is the end of life. You understand? Yeah, so you ought to advise your patients about the choices of coping mechanisms that they make. You understand? Yes. They must overcome, they must avoid behaviors, for example, the avoidance behavior. Avoidance, you're trying to also stay away from people. This comes in favor of healthier alternatives, supports long-term stress management. Now that is the coping mechanism. It supports long-term stress management. Then there are the signs and symptoms of stress. We have physical symptoms, for example, headaches, muscle tension. Now, these are some of the things that you can consider to tell that this individual is actually stressed. By the way, it is very important to look at the stress because your patient will not heal at the period that you have calculated unless they have relieved stress levels. Emotional symptoms, for example, irritability, anxiety, depression, and mood swings, feeling overwhelmed, and others. Yeah. However, these individuals also lack motivation or focus, and there we shall know that they are actually stressed. Cognitive symptoms may include memory problems, difficulty in concentrating, racing thoughts, constant worrying, and then poor judgment. Yeah, like we have seen that memory problems, an individual cannot remember very well, an individual cannot concentrate well. That is one of the cognitive symptoms of stress. Then the other symptoms, we have behavioral symptoms. One, increased use of substances. For example, alcohol or drugs, changes in eating habits, social withdrawal, and other behavior that individuals perform when they are actually stressed. Then interpersonal symptoms, this may include withdrawal or sensitive of criticisms. You feel like all the time you feel like you're criticized by other people. You get it? Yes, you are. When you have that sense that other people are always talking about what you're going through. You understand? Yes. So lack of communication or empathy towards others, that's also a sign of being stressed. Feelings of helplessness, low self-esteem, a sense of control over one's life, all these ones have led to stress. This comes to the end of our lecture for today. In the conclusion, recognizing the signs and symptoms of stress is crucial for implementing effective coping mechanisms. I think that one is clear. It is therefore essential to address stress promptly to prevent long-term negative consequences. In other words, in case you have a friend who is undergoing perhaps stress, you try to direct them on how they can access counseling and psychological services. I beg to stop here for today, and I guess it has been a wonderful lecture. You will excuse me for any area that has not gone appropriate. These were our objectives for today. I guess we have tried to achieve them. And today's lecture was on self-care and stress management strategies. This is under the psychology module. Thank you. Have a nice time.